Good afternoon. Thank you very much for the committee that have give me a chance to come here and present my work. So I come from the Center of Molecular Medicines in University of Medicine and Pharmacy, and we have collaborate with the Children's Hospital 2 in Ho Chi Minh City, so to do this research, the Stromal Collagen type 11 in expression in neuroblastoma. So this just briefly introduction of my college and my place institutes that we have a 15th floor for education and research just finished last year. And we have a biobank, we have the NGH hub, we have a lab bench for research, we have more than 50 physicians and scientists doing the children cancer research. And we collaborate with the Children's Hospital for 2 in Ho Chi Minh City with the more than 200 beds, 2009 for the oncologists. Before that, they have other oncologists combined with the children oncologists. Okay. So my work is focused on the neuroblastoma. That is already talked yesterday a lot by many researchers and scientists. The neuroblastoma is very highly heterogeneous. When you cut the tumor, you can see there's a variant of a tumor, and when you want to look at inside of the tumor, you use the histologies, but you can see some of the tumor is covered by some of the surrounding cell, and we very interesting to this surrounding cell inside of the tumor we call it intratumor, or outside of tumor we call it peripheral. So the heterogeneity of neuroblastoma is classified by multidisciplinary approach for the histologies of CIMADA classification, or INSS or RGSS, and this can imply for the multimodal intervention, such as the conventional, or yesterday we only know about the targeted and individualized therapy. However, the survival rate is, even though we have a multimodal intervention, survival rate is well 50% in the developed country and lower than 30% in our country. The heterogeneities of neuroblastoma is not yet classified by the molecular subtype, even though the other cancer, children cancer, such as medulloblastoma, also classified. And we have a lot of recently throughout the NGS, we can see some of very interesting gene that mutated and can be a genetic signature of the neuroblastoma. However, remember that throughout of some of study, the children cancer mutation is very low, right? So our lab is focused on the microenvironment that can be enhanced or attenuated in the cancer progression. Some of work is focused on the tumor environment of the cell, that for example, immune cell, dendritics, NK cell, T cell. And my work is focused on the collagens, the scaffold that for the tumor that grows. Some of very famous collagen type 1 and 4 we already know, but these collagen can be also expressed both tumor and normal side. And recently, the type 11, that is very specific, expressed in the intratumor side, and so poor prognosis with the other cancer. So we focus on this expression. So the arm of study, the express and specific localization of the COL11A1 and link with the clinical pathology is significant. And then we also carry out some of the function of COL11A1. So we collect the patient from 2010 and finished last year. with INS stage, age, classification, biological feature and application or not, loss of 1P or 11Q DNA polyploidy, and we do the laser micro dissection for discuss out some of the tumor and normal size of the tumor. We do the Q RT-PCR. We do some microarray, tissue microarray immunohistochemistry for the COL11A1 and some of marker. And for the function, we do the cell-based assay for invasion and migration. So first one, when we do the screen, and very interesting, we can see that the COL11A1 is this is the inside of tumor and this is the outside of tumor. They present very low, but inside tumor they present 50 or 45 to 50%. Compared with the Martian crystallome, the Martian crystallome is a marker for the collagen, the general collagen that you can see there. They can localize outside or inside. And vimentin is another stroma marker that also not specific determine the outside or inside marker. And we see that the expression of COL11A1 is very specifically localized in intratumoral or some of the tissue compared with the other, and the immunostaining score up to 40% average compared with the peripheral tumor. And we carry out some of the cohort patient of NB that we see that some of the stage 1 and 2, stage 3 plus 4 no amplification or amplification, and we see that the expression of the COL11A1 is increased in and significant with the correlate with the mid-end amplification, and with the later we also sort out of the patient for the low risk and high risk. We can see the higher expression of the COL11A1 and also the survival significant in the expression of COL11A1, so that the patient is much survive compared with the high expression. And next, we also see some of microarray public data that from the Vetters group. They already have a lot of number of the neuroblastoma in the Netherlands, and we compare with this public data, and we see that with the mid-end application, the expression of the COL11A1 is significant increase compared with the stage or the age. And the survival rate also, when compared with the other public data of microarrays in the SIOP and COCAT. And then we try to see the sum of part way that correlate for the regulator of the COL11A1, and we combine with the COCAT, Vetters, and SIOP QC to see some of the COLI of 480 gene that is important, and the TGF-beta is the one in the upstream. So we thought that TGF-beta would be a good candidate for the upstream of the COL11A1. We treat the TGF-beta in the neuroblastoma cell line, and we see that they increase the invasion and migration. And when we knock down of the COL11A1 or knock down of TGF-beta receptor 1, they reduce the invasion and migration. And this study still continue to compare the other relapse or non-relapse of the neuroblastoma, or some of the feature or some of the novel drug that are important for the target of the COL11A1. Still continue. So to conclude that, I already studied the increase the COL11A1 expression in the intratumor site of neuroblastoma and is associated significantly with the poor prognosis in the patient with amplified MIG-N. And deletion of the COL11A1 is attenuate invasion and migration maybe throughout the TGF-beta. And continue, we study the role of COL11A1 is maybe essential for the microenvironment of the neuroblastoma progression. So I highlight some of the my college and my physician in the children's hospital too that help us to work, and some of the partner in the Queen Mary University of London and NCI or A-Star of Singapore. So thank you for your attention. That's it.
Okay, may I have a question? It's a very nice study. So you said that COL11A1 is a downstream target of TGF-beta 1.
Yes.
What about MIG-N? So MIG-N could target the COL11A1. Do you have any data?
We also try to do some of promoter assay to see any clear that the MIG-N can do something for the expression of the COL11A1, but we not yet find any significant. Maybe we need to collaborate with the other MIG-N group that have some very good study about the MIG-N, so maybe it's help. Yeah.
Then does this COL11A1 generated by stromal cell or tumor cell itself?
We don't know. Some of the neuroblastoma cell also we do the RTB cell. We see that some of neuroblastoma cell also express the COL11A1. So until now, maybe the fibroblast, the stromal cell can express the COL11A1 or the neuroblastoma itself can express. We don't know yet, but we have the data that the expression of the cell line of neuroblastoma, some of cell line express the COL11A1.
Okay, yeah. Thank you very much.
Yeah.